In this edition of Focused on Performance, we will be discussing ICD-10. Most healthcare leaders today find it overwhelming to stay current with constantly changing regulations, let alone develop an organizational plan to stay compliant. When it comes to ICD-10, as you can imagine, readiness is regularly cited as a top concern. And rightly so. I-10 will substantially impact healthcare organizations. The new code set includes 5 times as many as the I-9 code set and a different arrangement of codes that will require significantly more documentation specificity and completeness. Many healthcare organizations, realizing what is required to transition successfully, have already begun preparing for this difficult change. While the rest of the world has been using ICD-10 for over a decade, healthcare organizations in the US are just now beginning to analyze existing ICD-9 data using mapping applications to assess documentation gaps. Healthcare facilities that have successfully implemented clinical documentation programs are better prepared. At minimum, organizations should have already established a task force to delineate timelines and assign responsibilities for education, data mapping, analysis, system preparedness, and forms and workflow redesign. Creating and executing a roadmap for this sweeping change sets a foundation for success. Change management will be a key factor and one of the more challenging aspects of this process. Assessing the coding skills of staff in the HIM department, physician offices, and hospital departments are equally important, and training should be focused, content-specific, and conducted in phases. As your organization forms a plan, be realistic about what you can and cannot do. If you have to ask for funding to outsource certain components of implementation, be clear in what areas and establish metrics to measure the return on investment. There's a lot to consider, and I can't stress enough that you cannot overplan for this transition. ICD-10 will undoubtedly provide greater detail for collecting and reporting diagnosis and procedures that ultimately result in improved care for the patient. Organizations have to think beyond 2013 and the effect of the coding changes on the revenue cycle. However, with careful planning and execution, the change will bring a positive and lasting impact to any healthcare organization. For more information on this and many other topics, contact us today.